Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
Well, good evening, and welcome to Doctor's House Call. Remember that number, 474-2427, out of state, 928, 474-2427, because the doctor's in the house, and if you got a question for him, he'll be glad to answer it for you. Tonight's program, we're going to hear Gene's story, from invalid to winning in golf tournaments. Dementia and Parkinson's continue to improve. So, we're looking forward to that. Good evening, Doctors Gear and Dr. Wyrick this evening.
Mike, and hello everybody out there in Radio Land. My, it's nice to have you here this evening, listening to our stories and things that we can tell you and how you can get better yourself. You can stay younger longer in your brain, your body, and in relationships. You know how good those relationships are. On this show, coming just before Mother's Day, in 2021, Gene Robertson says a great, big, humongous, tremendous thank you to his wife, Melissa, for being his surrogate mother and bringing him to us to be his healing doctors at Payson Health and Wellness Center. He was in the full downslide of pain and hand tremors, shuffling gait, slow thinking, slurred speech, depression, and more. Some of his problems are suffered by all of our listeners. But before he and his wife, Melissa, tell you his personal story, let Dr. Wyrick and me give you a brief overview of what the symptoms are in intention tremors, Parkinson's disease, dementia, and leading into depression with its problems. I'm asking Melissa and Gene to listen carefully and put a check by each symptom which she observed Gene suffering with and those known only to Gene before bringing him to us. When she tells us about him in just a few minutes, it will be interesting to have her tell us all the medical path they went through together before coming to us and what it was that was the deciding moment in their lives to be able to get some help that was really effective for him. If you relate to these one or all, then you need to get help before the nerves get past the point of no return. That does happen. Pain and Parkinson's disease, originally described in his essay on the shaking palsy by James Parkinson, whom the disease was named after. Get this, all of you, he lived from 1755 to 1824. Isn't that amazing? That many years ago. Awesome. 40 to 85% of patients have pain. A large number have fatigue. These are people with Parkinson's disease. Now, we get into the details of the symptoms, not only of Parkinson's disease, but most of the diseases of aging too soon. Dr. Wyrick.
Well, there are non-motor symptoms. That means things not related to the muscles and the brain's control of the muscles. We are talking about things like cognitive impairment, depression, anxiety, sleep disturbances, gastrointestinal abnormalities, such as slow transit, which leads to constipation, neurological and sexual dysfunction, orthostatic hypotension, which means you get dizzy when you stand up, visual and sensory disturbances, and apathy.
So pain, complex perceptual disturbance. Big words. The musculoskeletal pain. You know what that is? That's your muscles in your joints. Rigidity and bradykinesia.
What is that?
Rigidity?
Bradykinesia.
Bradykinesia, that's slowing down of everything.
Slow motion.
Yeah. People are in, many years ago, in the 1930s and 40s, there was a African-American who was a star in the movies. And he had this real slow motion. His nickname in the movies was Lightning. That was an opposite, of course. But he was having a real hard time getting his body to move rapidly. That's part of this disease process. In fact, Gene's going to tell you a little bit about what he had in it. So, bradykinesia causing alterations in posture and movement, such as stooped posture with head forward and shoulders bent forward. Walking with smaller steps, unusual musculoskeletal stress, and muscle cramps with joint-based pain. And we have a caller. Hello, caller. You're on the air.
Good evening. My husband has PMR, and I was wondering if there's anything that you could help him with the pain.
What is PMR?
Polymyalgia, fibro-rheumatoid arthritis, or something like that.
Okay, so it's usually called fibromyalgia or
Yes.
polymyositis?
All I know is polymyalgia.
Yes, many muscle pains.
Right.
Yes, so we do treat that in our office. Both Dr. Gear's spinal manipulations are beneficial in improving blood flow to affected regions, and I do internal treatments as well.
And we also find out which foods a person makes antibodies toward so that we can get those out of their diet. I just had a woman today that we did the second time on her IgG testing. This is the antibodies that are made against food. Originally she had about 35 different foods. Now she had 28 different foods. So in a year's time, with treatment on her spine, she had gotten much improvement. And the foods range from a +1 to a +4 in intensity and antibody formation. And this time she had a whole lot of 1s and not very many 2s or 3s and no 4s. So she got a lot better.
And what Dr. Gear is talking about is food allergies, which are often not tested for in the way that we're talking about, that lead to inflammation, and widespread inflammation throughout the body is what causes the widespread muscle pains.
It also causes the nervous system to not work right, causes the joints to wear out too soon. And I'm sure Melissa and Gene will tell you a little bit about all that once they get on the air. Did we answer your question, ma'am?
Yes, and do you take supplement Medicare?
Unfortunately, Medicare will pay for spinal manipulations only, which is something that Dr. Gear does. Anything that I do is not covered by Medicare because I'm a naturopath, and Medicare does not recognize naturopaths.
But we work with your primary care doctor as much as your primary care doctor will allow us to work with them. And those things that laboratories can do that your primary care would agree to, we'll tell you, and you can ask your primary care to do those tests for you. So that's how we handle that.
Okay, he's managing his pain now by taking prednisone.
That's a short-term solution, but in the long term, it will cause many, many problems. I have better solutions, but unfortunately, not covered by Medicare.
Okay, thank you for now.
Okay. Well, thank you, ma'am, for calling in. All right. In continuing on with the pain complex and perceptual disturbance, musculoskeletal pain, you have cramping or aching most commonly occurring in the neck, arms, back, or calf muscles. Joint pain most frequently originates in the shoulders, hips, and knees. Tends to be more pronounced in the more affected side. They may or may not be related to motor fluctuations. They may occur just in the morning or just in the evenings. They can correlate with new Parkinson's disease rigidity symptoms, that is like a frozen shoulder. Can mimic rheumatoid arthritis. Well, I see so many people without Parkinson's disease that have all these same symptoms. And it all comes about because of injuries in childhood and bad food for that individual that causes them to mount an inflammatory reaction because the body thinks it's an invading organism. So then we go on to other things, and I don't want to bore our listeners with all these details here. Dystonia, that's sustained muscle contractions causing twisting and repetitive movements or abnormal postures. That can cause you to have scar tissue inside your muscles. It can be brief or prolonged or continuous. These are all these variables. Most important thing is to make sure you get the cause of the problem taken care of. Dr. Wyrick, Tell us a little bit about nerve pain.
Well, it's pain due to neuropathy in general, and one form of neuropathy that Dr. Gear particularly works with is something called radiculopathy, where the nerves coming out of the spine at the various spine levels are getting pinched, if you will, is the lay jargon for that. It's a pinched nerve that can cause burning, electric feelings, tingling, numbness.
You know, I just took care of a patient this afternoon, Dr. Wyrick. You were there with me.
Yes.
And he had been injured in 2006 when a car hit him, and it caused him to have some pain in his right lower rib cage area, right mid through lower rib cage area. I had gave him an adjustment on his spine today, his second adjustment ever with me. He'd had many chiropractic treatments in the past, but nothing was really working for him. So today on his second adjustment, I made a thrust in his left upper thoracic, and he felt immediate pain in his right anterior lower rib cage, where the rib and the cartilage meet.
So you pressed on the lower left back, and he got a pain in the right front of his ribs.
No, I pressed on his left upper back.
Left upper back.
And he got a pain in his right lower rib cage in the front.
Okay.
Now, what that was is I was reversing the trauma in his spine and his rib cage that was put there when the car hit him. And the pain that he felt was the rib twisting on the cartilage back toward where it should be. Because in a matter of a few minutes, he had soreness but no more sharp pain. That means there was no fracture, there was no dislocation, he was not injured or damaged with the treatment, he was corrected with the treatment.
But we did have to apply ice to get him through the initial reaction phase.
Yes, the initial immediate reaction, put an ice pack on him, cooled everything right down, and then had him do some deep breathing while he was laying there with the ice pack. And we're talking only in a matter of, 4 or 5 minutes total time. And that he was so amazed to get that change in him so rapidly. And he said, yeah, I can move my arm around now. I don't have any sharp pains at all. It's sore, but that's to be expected since it was 15 years ago that the car hit him. Isn't that something? To make a change this quickly in something like that. So
Yes,
Dr. Wyrick.
He called in previously after his first treatment and was amazed at how much we had done for him in one treatment. So the saga continues.
Yes, that was just a few weeks ago. Okay, so then we have primary or secondary Parkinsonian pain. Most commonly affects the body side with predominant motor symptoms. Does not follow specific nerve patterns. Variable, described as diffuse burning, cramping, stabbing, aching, crawling, or a vague discomfort. TAB can affect unusual areas such as mouth or genitals. Oh my. So Dr. Wyrick, TAB restlessness or akathisia.
Well, akathisia is a fancy word for restlessness or inner feeling of restlessness, inability to sit still, an urge to move, and it's sometimes confused with restless leg syndrome, but it's really related to Parkinsonian symptoms.
Well, it's all part of the same thing, really, once you get right down to it and you start winnowing out all of the symptoms and what the causes is of all of them.
Yes, and then we have gastrointestinal pain, which is associated with Parkinson's and change in muscle motion. And in many cases, the gastrointestinal symptoms that are attributed to Parkinson's are actually due to the pharmaceutical treatment that is used to treat Parkinson's. In our office, we're using a nutritional approach rather than the medications that cause many symptoms of their own. And Gene doesn't have any of the common gastrointestinal symptoms that are associated with taking the pharmaceuticals.
So what we found was fatigue was a major symptom in Parkinson's as well as in many other diseases. And if you've got bad gut function, you're going to be fatigued. And if you're eating food you shouldn't be eating, you're going to be fatigued. And if you're doing all that, your nervous system's going to start not working right. You've got spinal deformities that can occur. Scoliosis, usually acquired. That's traumatically induced from a remote time in the life of that person and not idiopathic or genetic in origin. That means not born with. Postural abnormalities, stooped forward with flexed neck. I see so many people as they get older in this forward stooped position with their head forward. Gene has some of that. Not as much as he used to have. And then camptocormia, bent spine syndrome. This is an extreme forward flexion of the spine right where the rib cage ends and the small of the back begins, and often worsens during standing or walking, but it completely resolves when lying down. That means they can, when they lie back on their back, their spines will straighten out. They won't stay bent. So, Gene and Melissa, what did you check off? Tell us what you've been going through now. It was 3.5 years ago when you first came to see us.
We did an assessment here of when Gene started going back to see Dr. Gear, and some of the Parkinson's symptoms that he was having was loss of personality, confusion. He couldn't do his job that he loves to do or play golf, which he would rather play golf than anything else in this world. And so I decided that I needed to do something because he just wasn't functioning correctly. And I heard Dr. Weimerick and Dr. Gear on the radio show, and I says, that's my answer. I need to
right here on this show.
Yeah. I have to get him in there because the medications that they were having him on, that weren't working. And so I says, okay, I'm taking you off all the medications, and we're going to go in and start a new chapter in our lives. And it's been really wonderful to see the changes in Gene. He doesn't have the confusion anymore, and his mental capability is a lot better, and his personality has come back tremendously. And
you mean you got back the man you married?
Yeah,
amazing.
Yes, and he just has blood flow back in his brain. That's the key to it all. And if anybody out there is listening and you're feeling that you need to have help, see these two doctors because they have done a lot for Gene.
Now, Gene, I got a question for you.
Uh-oh.
Were you a golf champion before you got sick?
No.
How come you decided you wanted to become a golf champion?
Well, hey, it's one of my favorite pastimes, and I get to help some people that need it. I mean, a lot of times with the golf, they have tournaments that help other people out, and anything that can help other people, I'm all for it. So I play golf as often as I can. I'm one of the few men that go home and says, honey, my doctor said I have to play golf. And get him to believe it.
Get her to believe it.
So, Melissa, you allow Gene to go out and play golf whenever he wants to?
Oh, absolutely. That's the best exercise that he can get.
Not just for his physical body, but also for his nervous system.
Right. Exactly.
The coordination. And the happiness.
Oh.
And the pleasure.
Yeah. Exactly.
All right. Every time you win a golf tournament, that's like catching a 20-pound largemouth bass.
That's a big bass. But no, I mean, golf tournaments are a lot of fun. You get a lot of great guys. I joined the Payson Men's Club, and I play as often as I possibly can because, like I said, if I can help somebody else out, I'd rather do that than not. There's too many people that don't help out.
So Melissa told you had to be more active?
Yeah.
And she told you what to do, and so whatever it was that you wanted, that you enjoyed the most.
And I said, yes, dear.
Now, right. So, Gene, how easy has it been for you to come in and get treatment for 3.5 years regularly?
Oh, I think it's a good thing. I mean, I enjoy it. Some people think I'm kind of crazy because I enjoy massage, but no, these doctors make it interesting. They're there to help you, and they're not getting anything special out of it. So
now you mentioned the word massages. Do you think what I do for you is a massage?
Oh no, yours is the fun part.
Oh. So Melissa, would you tell us what you think when you see me giving him an adjustment? What do you feel inside of you?
Well, I can see what you're doing, the manipulations that you're doing on Gene by correcting his neck, because he gets really stiff in his neck and his shoulders, and when you get done with him, he can move his.
When he first started, I remember he could hardly turn his face right or left.
Yes.
And we were able to get some movement on the right side pretty soon after he started, but the left side was really difficult.
It was really difficult. Uh-huh.
And you know what I had to do? I had to say to him, when I was getting ready to give him an adjustment, I'd say, hey, Gene, look at that pretty girl over there. And he'd start to turn his head, and bam, I'd hit him real good.
That will get him.
So, Gene, you're able to look around now when you're putting up your screens and when you're driving your vehicle.
Yeah.
You can see what's coming around you because you can turn your head now.
Well, it's an enormous difference. Like you said, before I started seeing you, I couldn't turn my neck more than about 12%. And now I'm up to about 95%. So.
That everybody out there listening ought to hear that, because if they got stiff necks and it's hard to turn your head, or you got neck pain, we can fix that almost 100% of the time with almost 100% of the people. However, we can't do it overnight. It takes more than one treatment. It takes a consistency, because by the time a person gets up into our age group, and Gene, do you mind telling people how old you are?
I'm 69 years old.
69. By the time you get into our age group, get into Medicare age, most people have had these problems for years, and their bodies have grown that way. And they keep shutting down more and more of the blood flow. And as the blood flow shuts down, then the tissues that blood goes to start shutting down. And when that happens, you start developing these other diseases. Now, you had symptoms of Parkinson's. Your neurologist has said to you, what? Now, Melissa, you told me what the neurologist had to say about his gait, or the way he walked.
Yeah, I explained to the neurologist that, he doesn't have a gait anymore because we've been seeing Dr. Gear.
I mean, he's not shuffling anymore.
He's not shuffling anymore. Not at all. I mean, I used to hear him shuffle on the floor at home all the time. I know exactly when he was coming into the family room or into the bedroom.
It was small steps and shuffling and not quick.
Not quick at all, no.
Right.
Now he can outwalk me.
Oh, my gosh. Well, I keep telling people this over and over and over again for the last, 57 years, going on 58, that this is what we do. One time I mentioned something like this on a television show in Phoenix, and the hostess said, "Oh, you can't tell people that." I said, why not? It's what I do. This is how people get, it's been that way all my life. People say, oh, you can't do what you say you're doing. Yeah, we can. We make the difference. And, it's not me that's doing it. All I'm doing is removing interference. And then the organic robot, now get this, the organic robot that was created on this earth for our spirit to live in is a self-healing organism if we give it the chance. If we give it the chance. And if you've got jammed up bones interfering with blood flow to the nerves, you got to unjam them bones. One of my staff gave me a scrub one time. It says, I fixed them bones. And that old spiritual song came from Africa, and the African Americans used to sing it back on the deep South. It was picked up by a lot of entertainers, but it was called Dem Bones, Dem Dry Bones. Dr. Wyrick, you know all the details of that song, don't you?
No, I don't know the details of the song, but I know the biblical reference where one of the prophets was told to go preach to a valley full of dry bones, and he resurrected the bones into living people.
Well, that's an interesting concept for sure. Anyway, we look at the living bones in people, and we want more blood to flow in those bones. And so we work diligently to remove the obstructions to blood flow. And then Dr. Wyrick works diligently to make sure that the content of that blood is as good as we can get it. Now, when someone asks how old you are, what do you say? If you're feeling honest, you might count up the number of years you've been alive on this planet. This is your chronological age. Easy to measure and always marching upward, year after year, no matter how hard you try to fight it. Melissa, if I ask you, how old are you going to play the female role and say, oh, I'm not going to tell you how old I am? Or are you going to tell me how old you are?
I am 56.
56?
Yes.
All right. You're a really spry 56, I must say.
Well, thank you.
So there's another perhaps more important age to consider. Dr. Wyrick?
And that is biologic age. Your biological age can actually be lower or higher than your chronological age. This is because it takes into account many other factors. For example, your genetics, your lifestyle, your nutrition, and any diseases or other health conditions, and many other factors. There is a way to directly measure your biological age, and it does not require the use of a calendar. This is to measure the length of your telomeres.
Well, what are your telomeres, Dr. Wyrick?
Well, telomeres are part of our DNA that is found at the ends of each DNA strand, sort of like the plastic caps at the ends of shoelaces that keep the shoelaces from fraying. In general, every time a copy of the DNA is made to make a new cell in our body, the telomeres in that new cell get shorter than their parent cell. When the telomeres get too short, the cell cannot make any more new cells, and when it dies, there is new cell formed to replace it, and then our body moves a little closer to death. We have ways to measure telomere length, and ways to slow down or reverse the shortening of the telomeres, and we do that at Payson Health and Wellness Center.
So aside from telomeres, there's another important factor that holds a lot of weight when determining your biological age, and it can send your biological age soaring past your chronological age if left unchecked. That factor is chronic stress. This is great news because stress is something you can control by harnessing proper lifestyle, nutrition, exercise, and spinal health habits. Doing so can help you turn back the clock on the traditional aging process. That's exactly what Gene is doing, with the help of his wife Melissa, as well as our help in guiding him and the spinal care that we're giving him in helping him roll back the clock.
And also nutritional support and special supplements.
Exactly. So, that chronic stress is the problem. So there's 3 essential tips you can use today to help make sure your biological age is less than the number of candles on your birthday cake.
Oh, so this is stress busting. And the first stress busting tip is to learn to recognize stressful thinking. Stressful thoughts trigger a release of cortisol, the stress hormone. There was a study of 122 adults found that writing about past stressful experiences increased cortisol over 1 month compared with writing about positive experiences or plans for the day. And then something else we do at Pace and Health and Wellness is heart rate variability biofeedback, or mindfulness practices, meditation, journaling, deep breathing. All of these can help you recognize when stress is rising by making you aware of your thoughts, heart rate, and other signs of tension. It has also been shown that biofeedback techniques can be used to teach you how to enter a more relaxed, parasympathetic frame of mind at will. And there is something posted on my website, or will be for this radio show, that talks about what is biofeedback. So becoming aware of stress allows you to better cope with stress.
Now, stress-busting tip number 2, get the right amount of sleep. Timing, length, and quality of sleep all impact cortisol levels, and also vice versa. Without deep, nourishing sleep, your body's cortisol rhythm is thrown off course, and you end up tired, irritated, and unable to focus on anything. Melissa, was that kind of what Gene was like before you brought him in to see us?
Oh, yes, it was. It was, definitely.
He wasn't sleeping very good, was he?
No, maybe he would probably get about 3 to 4 hours of sleep, if that.
That's amazing.
Yeah. Now he sleeps through the night, and he was sleeping in his chair before I brought him to see you. But now he's sleeping in the bed, and he's sleeping 8 hours.
That's fairly significant, isn't it? Rolling back the clock.
That's right.
Making him younger again. Getting him back toward his real chronological age,
Right.
instead of his biological sick age that he was at.
Mm-hmm.
So, exercise before evening, avoiding caffeine afternoon, and learning to relax in the evening can all help you sleep better, but sometimes even those activities aren't enough.
Yes, there are a lot more that we can say about what's called proper sleep hygiene. There are also genetic influences that we can evaluate with genetic testing. If you want to learn more, please schedule a free 15-minute consultation with me. That's Dr. Wyrick, by calling into our office during normal office hours. And on my website, for this show, I will put a link for further discussion of genetic testing.
So, stress-busting tip number 3, take advantage of the right supplements. Dr. Wyrick, how do we take care of the right supplements?
Well, if you use supplements wisely, you can target high stress and lack of sleep. So there are many to consider, and these are some examples that are individualized depending on your genetics and particular biochemical constitution. There's an ashwagandha, which is an ancient medicinal herb from India. It's an adaptogen. That means it helps your body adapt your stress levels and brings your cortisol into a healthy, balanced range. Ashwagandha turns down the volume on your stress response without neutering your emotions, like the downers most people are fond of. It is balancing. It's not suppressing.
What are downers, Dr. Wyrick?
Downers, that would be things like benzodiazepines and all
What's
the...
a common name for those?
Well, sleep medicines. But like Xanax, Soma, many drugs that people take to help them sleep, and most of them work for a while, and then you develop resistance and they don't work anymore. But if you try to stop, things are even worse.
So remember when I was a youngster and when Gene was a youngster, There's some people went around and said, hey, give me a Benny.
Benzodiazepine.
What did benzodiazepines do?
Benzodiazepines are GABA agonists, which means they interact with the part of the brain that responds to hormones called GABA, and also responds the same part of the brain that responds to alcohol.
And so what was the effect of these downers, of these?
It suppresses the autonomic nervous system.
So the bennies made a person calm down?
Yes, it reduces anxiety until it wears off, and then you have what's called the rebound effect, where you're more anxious than ever.
Oh my! So that's when they want another Benny.
Yeah, and the bottom line is that's called addiction.
Is that what addiction is?
Yes, when the drug wears off, you feel worse than before you took the drug, and so you need more of the drug,
now,
and
Melissa,
you need more and more and more.
Melissa, when you were working with Gene previous to bringing him to us, were you seeing a problem with the medication he was on?
Oh, absolutely I was. That's why I said, you're not taking this anymore. This isn't doing you any good. You know, your body is not functioning naturally like it should.
So we're not against medication, but we're
Right.
absolutely against improper use of medication. We're against medication that's not working anymore, or that's making somebody worse.
Yes, I had cataract surgery a few years ago, and when I went in for the surgery, they gave me a benzodiazepine, knocked me right out, and they did the surgery, and then it wore off, and I went home. And I haven't taken a benzodiazepine since because it was used properly.
That's the proper way to use it, isn't it?
Yes.
Absolutely. So we have, in addition to ashwagandha, there's melatonin.
Yes, that's the sleep hormone. It tells your brain it's bedtime.
Is that a natural substance?
Yes, it is. It's made naturally in the brain, but it's also available as a supplement.
Well, what happens if you take too much of it?
You get a little bit of a grogginess in the morning.
What happens to your body's own ability to make melatonin if you're taking a hormone outside of it?
Well, I'm not sure that there's a rebound in this effect in this particular case.
Maybe it doesn't make quite as much as it did before?
Well, it's all tied in with many other hormones, and in fact, it's tied in with serotonin, and it's closely related to dopamine as well, which is tied in with Parkinson's.
Isn't there an auto-regulation of how these things all balance out? You work on that a lot, I know, with patients.
Yes, there's many interactions between one hormone and another, and we have to be careful that we don't upset the apple cart.
So the bottom line is, sleep is a youth-restoring miracle for your health and nervous system. And when you have enough of it, you will enjoy.
You'll enjoy increased energy, vitality. You'll have endless vigor of a 20-year-old. Well, I can't make that as an absolute promise, but that's the goal.
Gene, are you feeling any different in your youthful vigor compared to what you used to be?
Oh yeah, I feel a lot different from what I used to. I got to the point where I had to sleep in a chair just about every night in order to get any sleep. And so when I try to exercise, I do my golf as my exercise because I can do thousands of steps in a day.
So are you younger now than you once were?
Probably.
So how much younger do you feel?
Oh, we won't get into that.
Well, you know, Gene is a whole lot younger biologically than he used to be. He's chronologically the same age, you know, the years that he's lived. But his body's working so much more youthful now. Is that right, Melissa?
Yes, that is.
So all these women out there with husbands, or husbands out there with wives, that they see their spouse that's not quite like they used to be. What is your advice to them, Melissa?
My advice is that to get help, you know, if you're tired of being in pain and seeing your loved one decrease and fail, and you just don't know what to do, I would suggest turning to Dr. Gear and Dr. Weinrich, because they will help you.
Melissa, my father told me, my father was a doctor also, so was my aunt. My father told me when I was, youngster, he says, people have to hear something 7 times before they really have grasped what it is you're trying to tell them. So I said the following spinal research finding over and over in the program since we began. And I've said it to you quite a few times as well. I hope you have not become bored with it, though, all you people out there listening. When you've come to understand it well, you can teach it to your friends and relatives. Dr. Weyrich, would you start in the conversation on this?
Yes. 40 years ago, Dr. Chung-Ha Suh, who is a PhD engineer at the University of Colorado, that would be about 1980, he did some research that showed that very little pressure applied to a nerve that comes out the spinal cord between the vertebrae. We were talking about radiculopathy. These are the nerves that get radiculopathy. So it comes out through that hole in the spine, side of the spine, and it makes the nerve, if there's a little bit of pressure on it, lose speed and function. A pressure of about 1 millimeter of mercury, which is about 1/760th of atmospheric pressure, began the decrease of the nerve speed of function. When the pressure reached 40 millimeters of mercury, the speed was reduced by 65%. That's just about 1/3 of normal blood pressure.
So what all this means is that if you have, an impact injury to your spine, or you've overstrained your back or neck, or you had a whiplash type injury from childhood on up in life, and it was not fully corrected, that means full range of motion restored with no more tenderness in the area of injury of the spine, the impact to the circulation in the nerve is going to cause a problem with that nerve function. When that nerve gets to the blood vessels of the particular organ, let's just say the pancreas, then the pancreas cells do not get their blood flow when they're supposed to get it, increased or decreased. If the pancreas cannot respond to information that it gets from the intestinal tract to make more proteolytic enzymes, or from the nervous system's brain and chemistry from the body to make more insulin, then over time this results in protein deficiency in the body, cell structure, which alters the old cells from normal function, and also alters the new daughter cells that are formed. Or, over time, it leads toward diabetes and all the symptoms related to that catastrophe in the body. Therefore, it makes sense to have good spinal examination at least once a year, evaluating the health of your spine to prevent premature aging due to arthritis mentioned about the spine affecting blood flow going to an organ, screwing up that organ's ability to function normally. Low thyroid malfunction with all its symptoms, or parathyroid gland malfunction causing bones to lose minerals too soon in life, called osteoporosis, or a low carotenoid level identified by our S3 test, which is the result of poor fat molecular digestion metabolism, and eventually dementia due to nerve cell food deficiency, or lack of libido, or flying off the handle too soon, too quickly, or just emotionally, whatever, due to poor adrenal gland function.
Now, remember that all the organs came from various levels of the spine, and their blood supply followed the formation from the spine. That means all of a person's organs and glandular tissues have to work in a sequenced harmony programmed by the DNA that came from the mother and father when the baby was created. This requires blood flow to increase or decrease as the chemistry of that organ is called upon to do its biochemical work during the cyclical rhythms of life that are programmed by the person's DNA.
So, Dr. Weyrich, can you tell us more about the cyclical rhythms of life?
Yes. Let's start with a Disney movie, The Lion King, there was a song about the circle of life. But there is not really one circle of life, but many. Each of these circles of life is a cyclical rhythm, and I want to talk more about some of the more important ones. So, a cyclical rhythm is anything in the body or environment that goes up and down at a more or less fixed speed. The speed of each different cyclical rhythm is controlled in part by clocks in the body or by events in the environment. The speed is usually called the frequency. The body has many different clocks that keep track of the cyclical rhythms of life. And we'll talk about a number of these below in our discussion. And they'll be going from the fastest frequency to the slowest. So the first frequency I want to talk about are brain waves. These go back and forth between 1 and 100 times a second. Different brain states are associated with different brain activities, which we can measure using a computer and sensors attached to the scalp. And the brain waves from the slowest to the fastest are called delta, alpha, theta, beta, and gamma. And each of these has different thought processes associated with it. The delta is associated with sleep, and gamma is associated with intense thought. In particular, the alpha state, which is between 8 and 12 times a second, is associated with a calm, relaxed state. I am board certified in using neurofeedback to teach you how to self-regulate your own mental state by controlling your brain frequencies. And I'll post a link on that on my website. Next comes the Schumannionosphere resonances, which control our body, but they're a natural phenomena. And these occur at about 7.8 times per second. The entire Earth vibrates with electromagnetic energy that repeats at a rate of about 8 times a second. And this is considered to be a healing frequency that corresponds to calm and relaxed alpha brain waves that we just talked about. What a coincidence. Now, the ancient Indian Vedas referred to this frequency as the frequency of Om, or the universal frequency.
The way I heard it was Om.
Yes, but it's actually...
And when we listen to the the ear for listening in space, what's the background noise of the universe?
I'm not sure. It is all many. It goes many different frequencies from very low to beyond gamma. But actually, 8 cycles per second is below human hearing. It's felt more as a vibration than as a sound. So we'll talk more about how we can use this frequency of Om to improve our health later in today's show. Now, next we have the heartbeat. That's 50 to 100 times a minute. It's interesting that the heart rate goes up when you inhale and goes down when you exhale. In a young, healthy person, the heart rate may change from 50 to 80 beats per minute with each breathing cycle. And we have biofeedback equipment in our office that can help you learn to improve this heart rate variability, and that improves your youth and functionality. So you can make an appointment with me, Dr. Wyrick, for a free 15-minute demonstration by calling our office. And then we have the breath. About 12 to 20 times a minute is considered normal. And as I said, there are health benefits of learning how to synchronize your heart beating and your breathing. The benefits include better self-regulation of emotional state, lowering your blood pressure, improving mental focus, and even there's a book that talks about how this improves your golf game. And then we have the CranialSacral Rhythm, which is about 6 to 12 times a minute. This is thought to be a pulsing of the cerebrospinal fluid, which is produced in the brain, but I'm not sure what the control mechanism control mechanism for that is. Dr. Gear, you're trained in craniosacral evaluation and treatment. Can you tell us more about that?
Oh, yeah. The craniosacral rhythm you mentioned is altered, slowed, or increased by injury. Now, the craniosacral understanding was codified by a Dr. Sutherland, who was an osteopathic medical doctor back in the 1930s. And I remember my aunt, Dr. Sarah Gear, teaching me about the skull and reflexes of the skull when I was 6 years old. That was chiropractic doctors really liked to work with craniosacral. I learned it through a complete education course, 1989, when I took it from Viola Fryman, Dr. Viola Fryman, over at the Osteopathic College of the Pacific in Pomona, California. She said I had the hardest hit of anybody she'd ever felt. I was a real blockhead.
But that wasn't your learning ability. That was her ability to feel your head.
Yeah, I was really kind of messed up when my mother had me, my birthing injuries. Anyway, I came out pretty good. I think I got a 99 on the final exam, and I could actually see the energy field of the body fluxing around the body. And I had to be able to do that, and I was able to tell my student proctor as well as Dr. Fryman what I saw, and both of them saw the same things. And we didn't say, oh yeah, that's what I see. She was very, very particular about that with people. Had to be very, very accurate with what you do. So the craniosacral rhythm is something that is scientific. Any kind of a blow to the head can alter the ability of the joints of the skull to perform their microscopic movements. Now, because the movements of the skull bones are microscopic, so many other doctors don't know that they move. They say, oh, the skull's solid, it doesn't do anything. Well, if you look at a dead person's skull, it's solid, it doesn't move. But when a person's alive, it's got fluid in those joints, and those sutures of the skull have movement. And it works with the craniosacral rhythm. And the sacrum, that's down your pelvis, has another action that goes with it, because the spinal cord has these tissues all the way around it called meninges, and it's attached to the skull where it comes out of the foramen magnum, and it's also attached down at the coccyx, that's the tailbone. So anything that goes on with one affects the other. And we work with people's butts as well as with their heads.
Yes.
And everything in the middle.
The pulsing of the fluid in the brain translates into pulsing fluid in the spine, which goes all the way down the spine to the tail.
Right. So, Dr. Weyrich, what is circadian cycle on a daily basis? What does the big word mean? What's the word circadian mean? Okay.
The daily circadian rhythm or cycle, which means once per 24 hours, comes from scientific Latin. Circum, or circa, means around, about. And dian comes from day. So it means around and about the day, 24 hours. This is very important, since many of our hormones change in a predictable way around the time of day. For example, cortisol is normally high in the morning and low in the evening, while melatonin is normally high in the evening. These hormones control how well we sleep. And, by the way, we have genetic testing and hormone testing that can help us to normalize your sleep, which, as Dr. Gear mentioned earlier, is important for a long, healthy life. If you're having trouble sleeping, schedule a 15-minute free consult with me, Dr. Weyrich, at Payson Health and Wellness Center, and we'll talk about what we might do for you.
Okay, so Gene, you started sleeping a lot better. So we started to get your melatonin and your cortisol back into balance, didn't we?
Yeah, it seems to work out that way. Talking about stuff I really don't know a great deal about, but I know when I'm not sleeping, I'm not good to live with. So, yeah. the work that you guys have done has been amazing.
So, Melissa, we've talked to you about different biochemistry for him since in the last 3.5 years of you coming in. So you've been working with Dr. Wyrick on getting some of the different chemistries going for him?
Yes, we have.
And we did the IgG testing on him?
Uh-huh.
So you got rid of all the foods that were irritating him?
Yeah, I've seen a big difference in that too, especially with his tremors. You know, if he eats something that's not good for him, his tremors will seem like they will start to flare up and shake more. Yeah, so that part has been really, really good.
Yeah, I noticed that his tremors slow down or stop completely quite often nowadays.
Yeah, they do.
In the beginning, his whole body shook.
Yes, it did. Uh-huh.
That was really quite a change.
Yeah.
You know, if people out there say, well, this chiropractic, what can chiropractic do for these internal medicine diseases, for these things going on inside the body? Well, if you're just treating the muscles and the reflexes, and you're not actually moving the bones in the joints and correcting positions so that blood flow is allowed to get to the spinal cord and into the brain properly, you're not going to make much of a difference. You have to get to the core of the problem. You have to get right into the meat of it all. And that's what makes the difference. Then the bones begin to get blood flow back in them. The organs begin to get blood flow back in them. The chemistry of the body starts to work in a balanced, harmonious manner. You know, there's lots of cycles in the body. You've got the monthly cycle of a woman. You've got the circumsolar seasonal variations that happen, you know, with the earth. You've got all this drying out of the earth and wetting of the earth in different places now. There's just all kinds of things going on with all these cycles in the body. So Dr. Wyrick, integrative medicine is what we practice. Tell us a little bit about that, will you?
Well, integrative medicine considers all the different cycles, the circumlunar, the circumsolar, the sunspot cycle, and it's what we practice at Payson Health and Wellness Center. The educational background of our physicians goes back more than 100 years. The academics are centered on how the body actually works and what happens to make the body not work properly. The body encompasses all of the organs and all of the tissues and all of the chemistry. For ease of understanding, I am oversimplifying the formation of the body. When the body is formed, the first tissue to be defined is the spinal cord and brain. Bumps form on the tube, and this beginning, cell structures grow to make all the organs, including the blood vessels, ligaments, tendons, muscles, bones, eyes, ears, nose and throat, hands and feet, and don't forget the nerves. All of these tissues are composed of cells that need to be fed, and their waste needs to be removed in a correct manner.
So when the spine joints have been sprained, there's an increase in joint fluid because the lymph drainage tube structures get squashed by the fluid buildup that occurs as a result of the soft tissue damage. So most of the time the body adapts to the damage because a person does not get proper manipulative correction to the joint structure, and scar tissue buildup and holds the bones in their adaptive twisted position. This causes long-term lymph drainage blockage. That results in long-term nerve not getting enough food and pressure buildup inside of it because the tissue fluid cannot move out as rapidly as it is trying to come in to the nerve from the capillary. So that's exactly what happened to Gene, and that's why he developed his Parkinson's type of symptoms. So proper evaluation by palpation, diagnostic imaging, and functional assessment documentation is preferable to simply taking the joints through ranges of motion and hoping for the best, or simply relaxing muscles or exercising muscles and hoping they would remove the lack of circulation to the nerve so that it would function normally again. That rarely happens once the scar tissue sets up following injury damage to the joints of the spine. The proper correction requires a high velocity, low amplitude, vectored force, properly directed with chiropractic type adjustment.
And when the obstructions to the proper feeding of the spinal nerves is removed, the endocrine system of the body and the digestive system of the body and the waste evacuation mechanism of the body begin to function more normally, the way the body is intended to function. Disease malfunction leaves, and health returns in full blossom.
So I invite all of you to come in for our free consult, just like Melissa brought in Jean. We did an evaluation, and then we said, here's what we need to have to get started. You come over to Payson Health and Wellness Center, right between the Culver's 260 Cafe and the American Legion. Payson Health and Wellness Center.
And you can call to schedule your free consultation by calling 928-474-7409.
Every Monday through Tuesday morning. No, not Monday.
Every Tuesday
through
morning through Saturday noon.
Get me all confused here. So maybe I need an adjustment, Dr. Wyrick.
Well, I've been doing that, actually.
Mike, thank you again for having a great show for us. Really appreciate it, but you didn't participate today.
Well, you've got enough people with better things to say here than I and Gene and, all his story.
Close attention.
Well,
You're really right in there with us, like all of our listeners out there. So I hope you all learned something from it all. We'll be back next week.
And check out our website, KMOGcountry.com, for copies of this and other programs.
And also check out drwyrick.com for additional supplementary information about our program today. Go to the multimedia
You've been
archive.
listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.